Good evening to everybody, and I hope you find wherever you are. I'm Roger. I'm the founding president of World Medical Students and the Director General of GLOHEALTH organization. If you decide to make this video today in Canada, it's to talk about global health. And talking about global health, we're going to emphasize mainly on mental health problems. You know, mental health is the main problem faced by Canada. It's one of the main problems faced by Canada, and we need to come with solutions. As a youth population, we need to come with solutions, to propose the solutions to the decision makers, and wait for resolutions, wait for results. So today we're going to talk about mental health, and talking about it, we're just going to raise some facts. You know, in Canada, around 1 out of 5 people have mental health problems at a certain age, and even in the childhood, being it a child from 12 years old, a young adult, or an adult will face health problems. And when I was doing my research, I found out that these health problems, these mental health problems, could be related to the population, the population and the workload, like the workload related to the population. We have a country where we have mostly adults, and the few children that are there, the few young adults or the few adolescents that are there have a big load of work to do. That's why in Canada we recently have a deficiency or a lack of workers. Yeah. So those children will have all the load will be on the children, on the adolescents, and on the young adults. So if we acknowledge that all this workload is only loaded on the adults, on the young adults, then we're going to see that these people will have extremely high stress levels. And facing stress level means you face a situation of depression if you don't take care of yourself. You face a situation of mental health problems as in general. Let's just have a brief notion of what mental health is all about. So I will try to read, and then you will try to understand. From CDC, Center for Disease Control and Prevention, mental health includes our emotional, psychological, and sociological well-being. It is how we think, we feel, and we act. It also helps determine how we handle stress, relate to others, and make healthy choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. So mental health is a problem to all stratas of life, all age groups, children, teenagers, and adults. So we are all concerned by mental health, and we should not think that mental health topics are stigmatized topics. We should talk about it, because if we don't talk about it, the key to mental health problems is discussion, communication. If you try to open yourself to somebody when you have depression problems, when you have overstress problem, then you're going to find a solution. 100% sure you're going to find a solution. So let's not be stigmatized about this topic. Let's not think that if you have a mental health situation, then we are mad, we're crazy. Because from this same CDC website, it's said that mental and physical health are equally important components of overall health. So mental and physical health are equally important components of the health situation, of the physical health. For example, depression increases the risk for many types of physical problems, particularly long-lasting conditions like cardiovascular diseases like diabetes and stroke. So if you have mental health problems, you are exposed to having chronic diseases and long-lasting diseases that will never finish. And if you also have those long-lasting diseases like cardiovascular problem, diabetes, you can also be affected to having mental health problem, because, for example, when you have diabetes, at a certain age, at a certain time, with the complication of diabetes, you will be unable to make children. You'll be infertile. You'll be infertile for men and female, male and female. So you will not be able to make children. And in that condition, I know if I'm the one being unable to make children, I'll be depressed. I'll be very, very destabilized, and that can lead to a mental health situation. That can lead to a mental health instability. And so we need to take action now. We need to emphasize on this topic now and treat it for once and for all. So I know what we need to do. It has to start from the base, and the base is us, the children. The base is us, the students, and the base is us, the workers. Mental health is not just a problem of developed countries or less developed countries. It's a problem of all, because in a country where the income is poor, where the last person has maybe $1 per day, in that country, that person will be depressed. That person will have money problems, and money problems initiate mental health problems. In a country where people work too much and have more money, working too much means working maybe 40 hours per week. That's a maximum of stress, and you will not be able to socialize with people. You'll not be able to meet new people. You'll not be able to make new resolution, to make new discoveries, and so on. And your mental health needs, your brain needs to make new things in order to develop well, in order to be healthy. Your brain needs to exercise, to discuss with someone else, to meet new fresh skins. Yeah. And also, I want also to emphasize this problem. I went to Facebook today, and what I saw there, I was really happy, because a friend of mine from the University of Chang, from the Faculty of Medicine there, doing pharmacy, he has a page. It's called I think I forgot his name, Jerry, yeah. He made a video talking about sex and health, having sex, sexual intercourse and health. It's very important to have sex, because sex, for people that are married, it's important to have sex, because it helps you sometimes to release stress, to feel better, because there are some people that take the sex to feel better, to be more constructive, to be more productive. So sometimes it's important. That was an aside. The same CDC website says again that when people work for a long time, taking care of their families, taking care of retired people, like in a retirement home for long, they may end up having a poor mental health. That's understandable. That's a fact. Like, for example, me, I work like 50 hours a week. I don't have time to meet my family. I don't have time to discuss with friends. I don't have time to take care of myself, like go to the gym. I don't have time to do anything because I'm working. That's surely not what I want to do, but I have to do that because I am a student and I need to pay for my school, for my tuition fee. You know, in Canada, school is not easy. The school fee is not easy for an international student, so we need to do that. So we are going to discuss on this topic in some days to come in a debate at the University of Ottawa with international students on how to manage their mental health, and we are going also to assist them in the management of their health problem. Maybe we're going to talk to specialists that knows more about the domain. We're going to make a partnership with those specialists so that they can take care of our students, and with that I think many problems will be resolved, like cardiovascular problems, like suicide, like stroke, like any other problem related to mental health. With that, I would thank you, and I would ask you to comment this video. If you have a mental health problem, do not hesitate to contact GLOHEALTH organization, and we are going to discuss with you. If you need a friend, I'm there. If you need a person to talk to, I'm there, and we are there. Thank you, and have a nice day.